This meeting is being recorded.
Hello, everyone, and welcome to Softfield Academy's webinar. We are really glad to welcome all of you. First of all, I would like to thank Dr. Ehrenraich for being with us and for hosting this webinar. Thank you so much.
Welcome, dear.
I wanted to give you a little bit more detail about how the webinar is going to happen. So we will start with the presentation of Dr. Ehrenraich, and we will keep all of your questions for the end of the webinar. Don't hesitate to ask your questions in the chat or in the Q&R all along the webinar, and we will just try to answer all of them at the end. Also, this webinar is being recorded, so don't worry if you're missing a part. It will be available on Softfield's YouTube channel from tomorrow evening, and it will also be subtitled in French, German, Spanish, and English for non-English speakers. Can we go to the next slide, please?
Of course.
So I wanted to start by speaking a little bit about Dr. Mimi Ehrenraich, who is a surgeon from Israel. She is an Israeli certified and based general surgeon with vast surgical experience from Rambam Medical Center in Haifa. She has over 25 years of surgical, medical, and aesthetic training and teaching activities. At present, Dr. Ehrenraich dedicates all her professional time to the field of aesthetics. She is the owner of clinics in Herzliya and Haifa. She participates in clinical studies and formulation of protocols for aesthetic technologies, local and international trainings. She is also a consultant for aesthetic complications and safety, a KOL, and an international speaker at the field of aesthetics. She's been an expert for Softfield for many years now, and we are really glad to having this webinar with Dr. Ehrenraich. So I will leave you now, Dr. Ehrenraich, to start your presentation. Here it is. Tonight's presentation is about the differences about male and female injections. So yes, I will leave you to start the webinar. Thank you so much, Dr. Ehrenraich.
Thank you so much, Hannah, for presenting me. It was very flattering. I might even be hired. Good evening, everyone. I do guess we're all Europeans, so it's probably evening for most of us. This evening we are going to talk about male versus female rejuvenation. Not only rejuvenation, but actually beautification, making our patients happy by looking better. And the emphasis is going to be on male patients. The agenda is going to include, actually we are going to say a couple of words about a successful aesthetic treatments and the outcomes. What are the trends and who are the trend makers? About natural beauty, is it merely a marketing slogan or a market demand? And how is that differ, this demand from male to female patients? We're going to talk a little bit to touch the evolution of beauty concepts and phenotype variables between male and female patients. And actually there is lots of differences between men and women, behavioral, psychological, phenotype differences. We are going to discuss male specific considerations when choosing our product using AJ and the cannula, the tool we are working with. And then I'm going to present a full face treatment video of actually my camera guy. He's a better camera guy than a patient because he was talking the whole time I was treating him, having some issues with his camera guy. Okay, guys. So actually, I'm sure everybody that's in the aesthetic business saw the phenomenon, noticed the phenomenon that from 1996 till today, our waiting room has changed tremendously. Why 1996? Because this is the year the first AJ filler came to the European market. It was the Restylane. And in 96, we had mostly ladies who were fighting with aging. As for today, we have both genders, male and female patients, all ages, coming to seek actually beautification, coming to look more attractive. Now, there is another, this phenomena, I think, went much stronger and much further during the COVID. And I started, well, still male patients, especially straight male patients, are a much lesser percentage of our patients, of course, depending on the geography and the demography of our practice, where it happens. But during COVID, like after half a year since COVID started, I started seeing lots of straight male patients. And I started asking them, how come you come? Usually male patients were coming when getting divorced or their wife was bringing them. And they all of them said, listen, we guys, we look at the mirror for about 2 minutes when we shave in the morning. And what happened during the COVID epidemic? This is what happened. We got the Zoom. So guys were stuck in front of the Zoom for hours. Actually, this slide shows a phenomenon that is called Zoom dysmorphia. And because actually this angle of shooting is not really flattering. But male patients started to looking and observing themselves for hours and seeing their faces, and came to seek beautification. So both male and female patients coming to look better, but male patients and men are different from women, of course, you know, in every possible aspect. And to be a little bit heuristic, where our scope of interests is totally different. The consumption habits are totally different. You can see here a guy getting a shortcut, a haircut for $50 and looking totally different. And you see a lady getting her haircut, paying $500 and before and after looks totally the same. And of course, the self-esteem, the awareness, and the way we look at ourselves in the mirror. I've been noticing this phenomenon for years now, but lady, we're asymmetrical. We have a more successful and a less successful flattering side to our faces. A woman will always look, most of the cases, like 99% of women will look at the mirror. Her eyes will look at her less nicer looking side, and she will double it. A guy will always see himself better looking than he is. Okay, so this is all different. And when both genders are seeking for safe and natural beautification to look more attractive, they mean different things. Now, first of all, why natural? And for both genders, the definition is a bit different, and guys are much more fanatic about seeing themselves in the mirror, recognizing themselves in the mirror, and looking natural. But this thing that became a little bit too too awkward, and we see it much more with the Snapchat dysmorphia and all the Instagram filters. But this version of Mona Lisa is a real deal breaker for both genders, but for male patients, even more. Okay, so there is a very nice market research. Mind you, it was made 5.5 years ago, and it is based upon a broad market research and an interview with Stephen Dayan. Dr. Stephen Dayan is a very well-known and famous American plastic surgeon and philosopher. So the market research points that only 5% in the United States of the potential market are actual customers, meaning we have 95% of additional potential market that are not coming to work to their potential. First of all, because consumers fear of looking unnatural. People want to see themselves in the mirror. They want to see a better version of themselves. Okay, and for male patients, it is much more important, even more important than for female patients. Second, ouch doesn't work in cosmetics, fear of pain, and for guys, again, it is more relevant. Then it's the concern of the after effects of complications, and of course the general anxiety from doctors and clinics. So mind you that this research was made on female and male patients and the people, and everything that is said about women is much more important for male patients. So we said natural and safe beautification. So we're talking about natural, and now what is actually beauty? Why is it so clear to everyone who looks at Mr. and Mrs. Smith, the Brangelina couple, understands, clearly knows that they're the best looking couple, used to be at least, ever seen on screen? So the evolution of beauty concepts has lots of philosophical questions about it. Is there universal and timeless beauty? What makes us more or less attractive? And why and how male attractiveness is different from female attractiveness? So most of the research done comes to the evolutionism that is based on two principles. One is the natural selection, and the second is the mate selection. So the natural selection states that organisms inherently improve themselves, meaning the strong will survive, the weak will be extinguished. So there is, of course, preference for healthy individuals. And symmetry is one of the markers of, in our phenotype, in the way we look, of health. Second, there is the functional improvement, meaning the size of every organ and our actual size. When it is average, it means it survived. So average phenotype is the expression of optimal functionality, and it is correct about everything. When we are doing lips and we are exaggerating, it will not be attractive, even though we have filters in the Instagram that someone might believe it will be attractive. Okay, so average phenotype is very important. Second, as I stated, the evolutionism is the mate selection. So the goal of mate selection is to choose a partner that will contribute to one's reproductive success, meaning the mate selection is based upon our phenotype. Okay, females look at males to determine if they are successful enough, and vice versa. So main factor of physical attraction is our looks, and there is full correlation between attractiveness and fertility. And mind you, for male and female, it is totally different. You can be fertile when you're a guy 70 years old. You cannot be fertile when you are a lady 70 years old. So most of women, when they try to look more attractive, they try to cheat that we're trying to cheat that we're still fertile. It's like dyeing your gray hair and etc. So the visual mate preference cues is symmetry of the face and body, averageness for guys and girls, facial proportions that are, of course, different for both genders, the waist-hip ratio, the body mass index, and the age.